Hi, my name is Kelsey Berkner. This is part 2 of my final assessment video for Intro to Health Assessment. I'm going to pick up where I left off. I'm going to begin assessing the patient's 11th cranial nerve, which is the accessory nerve. So we're going to assess your accessory cranial nerve. For this, I'm going to ask you to shrug your shoulders up. Perfect. And can you turn your head to the left and all the way to the right? Perfect. I'm going to have you do those same things with a little bit of resistance. So I'm going to put my hands on your shoulders and try and press up. Okay. And try to turn your head against my hand of resistance. Okay. And on this side. Perfect. Okay. So the patient was able to push against resistance without difficulty. Strength was equal bilaterally, so there are no deficits there. Next, we're going to move on to the 12th cranial nerve, which is the hypoglossal nerve. For this one, I'm going to ask you to stick out your tongue and move it up, and stick it out and move it side to side. Perfect. Now I'm going to ask you to, I'm going to put two fingers on your cheeks and push from the inside of your mouth with your tongue out against my fingers. Okay, perfect. And on the other side, perfect. So the tongue has full range of motion and strength is equal going to both directions. So that's great. So the patient has appropriate verbal, eye-opening, and motor responses. So you would score, you would score a 12 on the Glasgow Coma scale, which is perfect. That is what it should be. So that's great. No deficits there. Now we are going to begin our musculoskeletal assessment. For this, we're going to begin by testing out the strength of your upper and lower extremities. So I'm going to ask you to stick your arms out like this. Perfect. Push up against my hands. Perfect. Pull down against my hands. Perfect. Now do your arms like this. Push out against my hands. Perfect. Pull back against my hands. Perfect. Now I'm going to have you squeeze my 2 fingers with both of your hands. Perfect. So all upper extremity strength was equal bilaterally. Strength was completely intact. There were no deficits. So that's great. We're going to move to your lower extremities. You can push your legs out against my hands. Perfect. And pull back against my hands. Perfect. Leg strength equal bilaterally. No deficits there. Now I'm going to have you stick your feet out. Push down against my hands like gas pedal. Perfect. Use your feet and push back up against my hands. Perfect. Foot press strength is equal bilaterally as well. There are no deficits there, so that's great. Now I'm going to assess your reflexes. Going to assess the bicep reflex. So if you can just rest your arm like that, perfect.
I was like, wrong one.
Okay. Now we're going to assess the tricep reflex. So I rate the bicep reflex as probably a +3 and the tricep reflex as a +2. Now I'm going to assess the patellar reflexes. Can you cross one leg over the other for me? Perfect. Okay. And we can do the other side. Perfect, thank you. Okay. And bilateral patellar reflexes were +2 as well. Now we are going to do some sensory testing. The first test I'm going to do with you is your ability to tell objects by their shape. So I'm going to have you to close your eyes and open your palms out. I'm going to put an object in one of your palms. Just feel it and let me know what you think it is.
Okay. It's a key.
Yes, that is right. Give it back to me. I'm going to put an object in your other palm. You can have your eyes closed and open your palms. Perfect.
It's a coin.
That is correct. And that is called stereognosis. That is intact. And we're going to also test another sensory test called graphesthesia. So you can close your eyes for me and open your palms. I'm going to write I'm going to write something on your palm. Let me know what you think it is.
Is that a 4?
Yes.
Okay.
I'm going to write on your other palm. Let me know what you think it is.
Is it a 7?
Yes.
Okay.
Correct. And again, that is another sensory test. Now we're going to do point location, so you can close your eyes once again. Just let me know where you feel me touch you, okay? This is a sensory test for your extremities. Okay? 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 Yes. All right, perfect. You did great. You recognized all the sensations on your lower extremity, so that's great. What we're going to do now is check coordination and balance.
Okay.
So I'm going to have you do some rapid hand movements. Just go like this, back and forth with your palms against your lap. Perfect. Movements are smooth and equal, and you're able to do it rapidly. So that's great. Definitely no deficits there. Now I'm going to have you put your finger to your nose. I'm going to stick my finger out here. Just go back and forth between the two with your finger, okay? As fast as you can. That's great. Now do it with the other finger. Same thing. Perfect. No deficits there. And that is coordination and balance and smooth movements. So that's great. Now I'm going to have you stand up for me. We're going to do a heel to toe walk. So just put one foot right in front of the other. Just like that.
Okay.
Perfect. And you can come back. Perfect. You were ambulating with an even and steady gait. You were able to walk one foot in front of the other without any deficit or without any difficulties or trouble, so that's good. No deficits there.
Okay.
I'm going to have you go have a seat on the couch. You can lay down actually. And I am going to listen for your vowel sounds. I'm going to start in the right lower quadrant and work my way around to all 4 quadrants. Okay, so vowel sounds were active in all 4 quadrants, which is good. That's what we want. Are you having any abdominal pain today? Okay, that's good. I'm going to press on your abdomen. Let me know if you feel any tenderness or discomfort. Any discomfort? No? Okay, that's great. Now what I'm going to do is listen for any vascular roots on your abdomen. I'm going to begin. Oh goodness! I'm going to begin with the renal arteries in the upper quadrants. And there are no roots noted there. Now I'm going to go down above the umbilicus or the aortic artery to assess for any roots. And there are none noted there. Now I'm going to go down to the lower quadrants, assessing for any iliac artery roots. And there are no roots noted there. So you can sit up normally now. All right, Stephanie, that concludes our physical assessment. Did you have any questions for me?
No.
Okay, and you didn't experience any discomfort during our assessment? Perfect. Okay. All right. This concludes my assessment for Intro to Health Assessment.